Hello, it's Ryan Liberty, and in this video I'm going to answer the question, what is Disinhibited Social Engagement Disorder, also known as DSED? It's a mouthful, so let's find out together.
Ooh, ah.
Okay, let's get to it. What is Disinhibited Social Engagement Disorder, also known as DSED? Before I get to exactly what it is, I just need to give a little cautionary advice here that this is not the diagnostic criteria for DSED, and it should not be used to diagnose anybody. This is merely a quick description to give you an idea of what's going on within somebody that has Disinhibited Social Engagement Disorder. Let's see if I can get through this video saying that. But this is just a description. It's not meant to diagnose anybody. Only a trained therapist should really be doing that. And also, the label Disinhibited Social Engagement Disorder, DSED, if in any way that bothers you, if that causes you distress to use that label, then you can just let the label go. This is really just to point you towards a pattern of something that's happening with somebody that has DSED. So with that said, let's get into what it is, and I've got my notes here as always to make sure I'm giving you good information. So Disinhibited Social Engagement Disorder is something that occurs in children, and it's typically something that happens where a child is comfortable approaching strangers, approaching adults that they're not familiar with. So they don't have that reluctance that a child normally has when they go to approach somebody. They just are willing to go straight up to them. They may act familiar with the stranger already. They may start to engage with them in conversation as if they know them already, or behave like they know them, like give them a hug, touch them affectionately. They don't have that thing that most children have, which is checking back to make sure the parent is still there and make sure that everything's still okay. They're just willing to go off with the stranger. That's just characteristic of the disorder. So these behaviors are not characteristics of ADHD, and it's important to distinguish that this is not attention deficit hyperactivity disorder. And typically what's going on in this situation is that there is insufficient care for the child. So either their emotional needs are getting neglected, their normal social needs are being neglected, so they're not getting comfort, they're not getting stimulation, they're not getting affection. Sometimes they'll have changes in the primary caregiver over and over again. It's like children who are in foster care, constantly switching between caregivers, or they may be in a setting that limits attachment. So they may be in a group housing and there's no consistent one-person attachment figure for them to attach to. And that what's going on in this situation is that that situation of not having correct care and not getting those emotional needs met and having the pattern of behaviors of the caregivers switching out or not being stable is what leads to the disinhibited social behaviors. So being willing to approach strangers, not having that feeling like they need to check back. All of it's connected. That's important to make sure that that's what's going on for this disorder. It's something that has been happening for since they were at least 9 months of age. Before that, you wouldn't use this label. And if it's something that's been going on for 12 months, it's considered persistent. And if it's something where they experience all of those things that I mentioned at a very high level, that's considered severe. Now, the good news is that there is treatment, and the treatment typically actually involves the parents or the caregivers. So it's education of the caregivers, it's giving the children a stable environment to grow up in, and giving them one caregiver that they can attach to so they're not switching out constantly. And then educating the primary caregiver on, parenting skills, good attachment skills, and possibly medication when appropriate to treat other things that this disorder could be comorbid with, happening together with. So what does it feel like for the person or the child who's experiencing it? As far as what's going on inside their body, I couldn't find a lot of information for that, but I would assume because this is a trauma and stressor disorder, that there's anxiety symptoms, that they're feeling a little bit stressed. They're feeling inside their body, maybe some sweating sometimes. Maybe they feel anxious, trouble breathing, hot and cold periods, and any of the symptoms of anxiety. I have a video on anxiety if you want to check that out. As far as what's going on in their heads, they may have trouble connecting thoughts, again, because this is a trauma disorder, and they may have trouble with a sense of time. They may not realize how much time has passed when you question them on time. Whenever something comes up with time, they may not have a good sense of how much time is actually passing. Emotionally, it's found that they generally interact with inauthentic emotions. So there's a very superficial layer of kind of fake emotions. So if the child's experiencing this, they're trying to connect in the way that they believe is the right way, but they're not getting in touch with their own emotions. And because of that, they may have difficulty recognizing their emotions or expressing them, which is also known as alexithymia. And then as far as their behavior, which is probably what you're going to notice if you're going to notice anything, is there's attention seeking and there's acting out. They are explorative, they're impulsive. Again, they'll butt into conversations and they'll act like they already know strangers and be comfortable going off with strangers, interacting with strangers, touching and exploring strangers. So that's just a quick overview of what Disinhibited Social Engagement Disorder is, also known as DSED. I hope that helps to give you a little better, well-rounded human perspective on it. If you have any questions or comments, please leave them below. And I am grateful that you took the time to learn about this today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.